If you're determined to age well, then you, my friend, are in the right place, because that's why we're here, to age well. Bloody well, in fact. Welcome to the Aging Project podcast. I'm Shelley Craft, your host and fellow ager. And in each episode, we'll dive into the nitty-gritty of what it takes to age well, learning from experts around the world and, of course, from each other. Why? Because aging well doesn't just happen, my friends, and each of us needs and deserves a support team. So you can think of us as your tribe or perhaps your cheerleaders. We're here to stand by your side, to propel you forward and spark yes you can choices at every age. We'd love for you to join our growing community. In fact, we're calling it a movement. And of course, try our free 5-day morning challenge over at theagingproject.com. It is a great place to start your aging journey, and this is a great place to kick off today's episode. Brought to you by youmusttryit.com, where you'll find supplements, skincare and makeup. We've tried it, we've tested it, and we love it, and it's all in one place.
5% of the world's population have type 2 diabetes, and around 7.5% of the world's population have pre-diabetes. Most of those people don't know they have it. And so this is the issue that we have. So there's a lot of people that have pre-diabetes that have no idea that they have pre-diabetes. And this is the time that you alluded to in your introduction. This is the really powerful time that we can reverse this metabolic dysfunction back into optimal states of well-being. And so it's much easier to reverse a disease right at the start of its dysfunctional phase than it is when it's right at the sticky point.
Today, we're addressing a critical issue that affects many Australians as they age: pre-diabetes and diabetes. We're highlighting this for two key reasons. Firstly, diabetes becomes increasingly common as we age, and becoming a diabetic raises your chance of other serious conditions such as heart and kidney disease. Secondly, on a personal note, a friend of the Aging Project, just 48 years old, recently passed away from a heart attack. He also had diabetes. The alarming reality is that many people are unaware that they may be in a pre-diabetes stage, a crucial window where action can prevent full-blown diabetes. Fortunately, with tools like continuous glucose monitors, or CGMs, that we'll talk about today, we can now identify these risks early and take steps to safeguard our health. So let's dive in and discover how we can stay ahead of diabetes and maintain what we all want, which is a healthy, vibrant life. We have called upon the fabulous Dr. Michelle Woolhouse. She is a GP, refers to herself as a holistic GP, which we'll dive into first. Michelle, it's so wonderful to have you with us. And I know this is a topic obviously very close to your heart as well. But can you tell us a little bit about your approach to healthcare and what brought you to referring to yourself as a holistic GP?
Wow, good question. Lovely to be on the show. Thanks for having me. So I feel like I've been a holistic GP all of my career. I fell in love with the idea of the whole. So when I was in medical school, I wasn't a great medical student, but then I became a really good one when I discovered psychology, immunology, and neurology. And then I discovered this kind of science of psychoneuroimmunology, and that allowed me to do a postgrad in that. And that is really the science of connection. And so connection and holism and interrelationship and integration has really been my wheelhouse. And so I just love exploring how everything interconnects, particularly for human health as well. Like, we're more than just our physical health. You know, we have so much. Our health is impacted so much by our social health, our relational health, our psychology, our spirituality. And I guess that is really where my fascination lies.
So, Michelle, does it actually surprise you that a majority of GPs are just looking at the one focus? For you, seeing the body as a whole seems like a really natural thing to do. How did medicine, I guess, get so far removed from treating the body as a whole?
Yeah, it's a great question. It's not that far removed, Shelley, to be honest. Like, you know, general practice training is all about holistic medicine. We all learn about what we call the biopsychosocial model of care. The problem that we have in this country, in this system, is that the system is designed for acute medicine, and it's really short medicine. And so in some ways, to kind of process more and more people, we're seeing people for shorter and shorter time. Now, the problem with that is we don't get to really deep dive into people's lives. I mean, GPs look after people from cradle to grave. So over that period of time, they understand that biopsychosocial model. But for those that haven't really invested in that relationship with their GP, they often feel like general practice is piecemeal, but in fact, it's not. So I always encourage people to really invest in that relationship with someone so that they can really have that opportunity to deep dive. But it's very difficult for a GP to actually ask that question, about a relationship or what's stressing them out when they've actually got a 15-minute appointment booked and they've got 4 people already waiting. It's much quicker and easier to give a prescription to close off and round off that consultation. So the GP gets deprived of that intimacy and depth, and the patients get deprived of it as well. And it frustrates me as an individual because it's like GPs are kind of burning out because of the lack of sort of depth and use of their knowledge. I mean, it's extensive what we learn. 10 years of study to be a GP, it's a lot. And patients get frustrated because most people these days have got a chronic disease, and that's what is swamping the medical system. So it's not like we go to the GP anymore with a fish hook in our hand or a case of measles, which is pretty easy to diagnose and pretty easy to treat. But the problem is we're going with a lifetime of diseases that take years and years and decades to occur, and therefore require this deep dive, behaviour change, lifestyle medicine intervention in which to get the most out of the person, and also reverse and potentially, improve somebody's health optimally.
So there is that responsibility from us too. And I know for one, as a young woman, I skipped around GPs because I didn't really want to deep dive into my own problems and lost that relationship with my childhood GP. Now, as a mature woman who's able to accept my out-of-body experiences, I can actually indulge more and, as you say, have that relationship with the GP. So again, we do need to take it upon ourselves to say, I'm not being a burden. This is about my overall care. And I think even those health diaries, if you're just taking more care of your own self and more interest in your own health, then of course you can help your GP in that short 15-minute time frame that you have for that chat. So I know our GPs have got it tough. They've got it rough, but we also need to take a lot better care of ourselves.
But I just want to tell your audience too, because this is really important, is that you can book a double or even a triple appointment if you really feel like you need it, particularly if there's something going on from a mental health perspective. And GPs really, really honour that. They really love having that extra time because they'll use that extra time for you. So I always say to people, be greedy with your GP. You deserve it.
Well, be greedy with your health because we deserve it.
Exactly.
Which is bringing us to today's topic, I suppose, this chat about pre-diabetes and the fact if we were more aware of our own health and what was going on in our own bodies, and more so how our body reacts to what we're doing to ourselves, we might have a better chance of catching diabetes before we enter this sort of pandemic stage that Australia is in now with type 2 diabetes. Firstly, can you explain the difference between type 1 and type 2 for us?
So they're completely different diseases, okay? So the same name, obviously, but type 1 diabetes is usually a disease that is discovered in childhood or adolescence, and that is caused by an autoimmune condition. And there is a damage to the pancreas that causes permanent damage to the insulin production of the body. And so that requires a completely different set of circumstances. Type 2 diabetes, which we'll discuss a lot today, is the lifestyle-orientated condition, which also impacts insulin, but it has a different mechanism of why that insulin is affected. And so the common issues with that is a gross overall deficiency or dysfunction of the metabolism. And that is caused by our modern day lifestyle. In fact, what we know is that type 2 diabetes rarely existed a couple of 100 years ago. And now we're in epidemic, if not close to pandemic levels of this metabolic dysfunction across the world.
And you would see that showing up, obviously, if you are carrying extra weight, that is going to be a key indicator of that. But I know there's also this sort of, I guess, misconception. We don't know what's going on inside our bodies and how our body is processing glucose. How do you know? What are the other signs that you might be in that pre-diabetic stage if it's not necessarily carrying more weight?
So the signs that we see for pre-diabetes is actually zero. In many ways. A lot of people have got prediabetes and have no idea that they have it and therefore have no symptoms associated with it. But if we take a little bit of a deeper dive, what we can see is often people, particularly in hindsight, start to recognize that they have issues with their energy balance system. So they're not maintaining their energy throughout the day. They may have slumps in the afternoon. They may complain of things like brain fog or poor focus or concentration. And then there's other aspects of, metabolic dysfunction that cause things like easy weight gain, sugar cravings or carb cravings, dysfunctions of sleep. And then for women, often hormonal dysfunction as well. So things like increasing PMT or worsening of that perimenopausal period as well. So they're kind of, I guess, the prelude to think about your metabolism in that way.
So they do all sound like perimenopausal symptoms, which could again lead to the fact that yes, your insulin is completely out of balance. So you're saying if we concentrated on that and made sure that our insulin resistance was reduced, or that our glucose levels were in that zone, that we may not suffer from as many of our perimenopausal symptoms as we have.
Absolutely. So basically what glucose metabolism is all about, or glucose homeostasis. So just to educate your audience, the word homeostasis essentially is a scientific word for balance, and it's super, super important. And the blood and the body use homeostatic mechanisms to create balance in the body. The more balance we have, the better our health. So when we have an adaptable system, so we can cope at times when there's extreme heat or extreme cold, where we might be dehydrated, where there might be not enough food or too much food, too much stress, not enough stress, that kind of thing, right? And so, but each time we come back into balance, the body comes back into balance, and then it's at optimal functioning. When we're out of balance, the body is stretched or stressed, and that creates the damage that we've got. The more that we're under stress and the more that we're out of balance, the more our body is going to respond in symptomatology to try and bring us back. This is the way the body kind of talks to us as well. So you think about perimenopause. This is a time where the woman's body is changing, and there is an increased risk of insulin resistance and metabolic dysfunction around that time. And as I mentioned before, a lot of women really complain about this increased weight, where our metabolism drops by about 200 to 300 calories a day. So we don't need as much energy as what we did in our 20s and 30s. And so there's this definite change that's happening. But the more we can stay in balance and lower our stress levels and keep ourselves in a nice harmonious situation, for want of a better word, the less we're going to be symptomatic of those hormonal fluctuations.
So again, it is this holistic approach. It's not just a matter of cutting out the sugars.
Yeah, absolutely. I mean, cutting out the stresses is great. Focusing on sleep is really important. Focusing on nutritional density is really important. Like, our bodies and our lives are quite stressed. Even though we're the most technologically advanced, privileged, group of humans to ever roam the planet, we're also the most stressed, which is, that's a topic for a whole nother discussion. But we've got to keep our holistic framework intact and look at the 4 pillars, what I call the 4 pillars of well-being, which is exercise, nutrition and diet, stress, and sleep. And so a lot of people will focus maybe on one or maybe on two of them, but we really have to look at that holistic paradigm and look at all four of those factors for optimal health.
So again, gaining control of all of those aspects of our life completely vital, and it may seem stressful and overwhelming to take on the challenge of gaining control of all of those aspects of our life. But the question of that insulin resistance, and that's one thing that we can, I guess, close off to say, no, I'm taking control of this, therefore my chance of developing diabetes in the future is greatly reduced. That should tick something off the list. You know, we're not the only ones who can age fabulously. Our dogs can too. When I started my own holistic health journey, I also started to question my dog's nutrition. What was actually in their kibble, and why did they never want to eat it? I quickly realised that if highly processed, long shelf life food wasn't good for me, probably wasn't great for my dogs either. So I started them on Lyka. It's a vet-formulated meal made from real human-grade ingredients, and it has been life-changing for all of us. My pups love their food for the first time ever, and they are in the best shape of their lives. No more itchy skin or tummy troubles. Check out Lyka, that's Lyka, and get 40% off. That's just for our incredible Aging Project community. Use the code AP40 at the checkout. How common is pre-diabetes in perimenopausal women? Is this something that is going to affect all of us?
Look, it won't affect all of us, but so the statistics are there's around about 5% of the world's population have type 2 diabetes, and around 7.5% of the world's population have pre-diabetes. Most of those people don't know they have it. And so this is the issue that we have. So there's a lot of people that have prediabetes that have no idea that they have prediabetes. And this is the time that you alluded to in your introduction. This is the really powerful time that we can reverse this metabolic dysfunction back into optimal states of well-being. And so it's much easier to reverse a disease right at the start of its dysfunctional phase than it is when it's right at the sticky point. And the reason for that is that there's a combination of when we become insulin resistant, we also become inflamed. And when we become inflamed and insulin resistant, we're much more likely to lay down fat. So it's this triad of what we call adiposity, so fat deposition, inflammation, and insulin resistance. And once you've got this triad in full-fledged, it's really much harder to reverse. It's not impossible to reverse, but it's much harder. So you want to kind of get it in that pre-menstrual phase for women, because their metabolism is a lot younger, it's a lot more vital, and it's a lot more reversible at that particular stage.
So how do we get our baselines then? Is this something that you do get in your 15-minute appointment with your GP? Is it something that you need to ask for specifically, or can we test our own glucose levels another way?
It's a great question. So for the last sort of 20 or 30 years, we've had a fantastic test called hemoglobin A1C. Now, that essentially tests your glucose or glycation levels over a 3-month period. And so it's a fabulous, fabulous test, but it has a couple of caveats to it. A, it's not great for iron deficiency, which is a really big problem for women. And the second thing is a lot of women's sugars are actually high and low, high and low, high and low, high and low. And so what you find with that is that the average, which is taken into account for the hemoglobin A1C, actually looks quite fine. And so this is where the magic of using a continuous glucose monitor has come in. So these little machines, which are basically like a 20-cent piece, they attach to the back of your arm and you wear them for 2 weeks, and you get dynamic, instantaneous feedback on your glucose response system over 2 weeks. They give you an average of that glucose over that time, but you can also see whether you're actually getting highs and lows, and and how you're responding to various different lifestyle interventions, what you're eating, how you're eating, what time you're eating. how long you're fasting, for, level of exercise, what's happening when you sleep, what's happening if you don't sleep well, what's happening after a stressful meeting, what's happening,
Oh my goodness, this could get really addictive, couldn't it?
Exactly. It is quite addictive. And it's quite fun too, because, we often, as women, we've often know a lot about what we should eat. We know a lot about our health. There's a lot more that we could know, of course, but women are really proactive about their health, and they do generally have a really good understanding of that. But we sometimes rest on our laurels. We might go out for a little chai latte in the afternoon, and swapping from maybe, a dairy milk to oat milk may be the critical factor that shoots your sugar levels up, even though, there's a lot of health messages to say, should avoid dairy and maybe have oat milk as well. And the feedback too from our CGM data is oats can be really problematic. Sushi is really problematic.
Don't say it, Michelle. Really?
Sorry, yes. Well, because there's that short grain rice is really problematic, and people are like, I had sushi. I've been having sushi for a long time. So sushi rice, not the
Well, the crumb chicken inside doesn't do you many favours either, does it? Or the deep fried prawn or whatever you're having in your sushi. Yeah, sushi, you've got to be very specific with what you're having there. But this is extraordinary. And I know Lindsay Kosh, our clinical nutritionist, she had been trialling one of the glucose monitors, and she did a test. She said, I can't believe I'm doing this. I haven't had fizzy drink in, decades. She had 3 little mouthfuls of a fizzy drink, and we watched, and it is on Instagram if anyone wants to check it out, watch this glucose spike happen in her body. And for her describing her feelings at the time, she said, oh, I'm getting the shakes, I can feel my heart's racing. And this is a woman who's incredibly in tune with her body. For the rest of us, we may never put those two things together. You have a swig of a fizzy drink and off you go, and 10 minutes later, you're sort of jumping around. Yes, we call it a sugar rush, but when you actually break that down of what that's doing in your body, it's quite extraordinary.
Yeah. I mean, I think it's really important to sort of see that as a stressor. Like, so obviously having, things intermittently and having some birthday cake or whatever is not a problem intermittently. But I think over the last couple of decades, we've really lost this connection between what we eat and how we feel. So obviously we know that what we eat will determine our body weight. So we've kind of got that, au fait. But actually how we feel, like energetically, I think we've lost a little bit of a connection between that, particularly with things like fatigue or even headaches or even anxiety. So when you get a rush of sugar and then a drop of sugar, as Lindsay was saying, that she might get tremulous, and some people experience sweating and actually being quite anxious when their sugar levels drop. And it's bringing back this observation. And then once you stop using the CGM, so, we recommend that you use it kind of intermittently to kind of get to know it. So you don't have to do it all the time. It's not like every 2 weeks you're always using a CGM. And then you start to kind of learn and intuit that understanding within your body. And as I mentioned before, it can be a really playful experience because, as Lindsay was doing, I haven't had a soft drink in 20 years. Let's see, how that goes. But the other thing that you can do as well is kind of have your cake and eat it too. So, for example, I would try, dark chocolate that was 70% versus dark chocolate that was 90%. And then okay, well, I'll try the 70% with a couple of almonds. And that didn't do very much to, my sugar levels as well. And so it's about combining your foods as well and making sure that you've got good levels of fiber and protein with your carbohydrates. And that makes a huge difference. And I guess if, for another example as well, I was eating muesli and some berries and yogurt in the morning, but I found that was putting my sugar levels up. If I added a little bit of extra protein powder to that yogurt, that was stabilizing my sugars. So that was giving me my high protein breakfast, but I had good levels of fiber in there and I had good levels of, fruits and nutrients associated with that. And that set me up for the day. And so I wasn't getting so hungry. And the other fascinating thing is that when we eat is really important as well. So we change our insulin resistance throughout the day. And so what we eat and how we eat, that's why a lot of nutritionists and naturopaths and dietitians are suggesting we have a very high protein breakfast to set us up for the day. And that supports our insulin levels and our kind of balance throughout the day. And to be really, really careful about sweet carbohydrate-based foods at night. So watching those pastas at night, watching not eating too close to when you go to bed. And the other thing that's really important for people to know is how important sleep is for insulin metabolism and glucose metabolism, because we have these beautiful, I guess, physiological ways in which we're meant to operate. You know, we're natural. We naturally belong to this planet, and so as the moon kind of rises, we're meant to, have these hormones that actually support our repair process, our inflammatory regulation process, and insulin is part of that. And that's really important to really foster very, very good sleep and making sure that we have a good period of fasting. I'm not talking necessarily, 16-8, but at least 12 hours of fasting is really important to rest the body, to rest the digestive system, to rest the detoxification system, so that we can actually properly do the work that the body has been evolved to do.
And again, that's just wrapping up dinner an hour earlier than you probably are right now. And we call it fasting, but ultimately, as you say, if there's 12 hours in there, it's just that gap between meals. It's not even really a fast, is it? If you're finishing dinner a little bit earlier and giving your body that time to rest and digest. So you can then, obviously, when you have one of these glucose monitors in, it's tracking you constantly for that 14-day period, which I guess is that playful fun time where you can go, oh, it's doing this, it's doing this, it's doing this. And then would you suggest doing it once you've got all your ducks in a row and you think you're organised, do it for another 14 days to go, yes, now I'm keeping consistent, this is good. And then checking it again a couple of months down the track.
That's right. I mean, so maybe 3, maybe 4 times a year. It depends on what your goals are. So if you do have a significant weight loss goal, or there's a significant burden of inflammation or poor well-being, then you could do it more. And depending also on your health literacy, like how much you want to know and how much you kind of want to test. But yeah, I think your suggestion is perfect. We've designed the program so, you have your first 2 weeks of data, and then you might do it 6 weeks later or 8 to 10 weeks later, depending upon your lifestyle. And then every couple of months you might go again. And I've done it probably about 4 times in the past 16 months or so. And each time is different. Like, for example, I was injured one time, so my exercise had changed. And so I was able to kind of look at the different exercises that I was doing and found actually that the high intensity exercise at my particular stage, of perimenopause was actually doing me a disservice.
So what, you were seeing a spike in your glucose doing HIIT?
So exactly. So I was probably a bit stressed because, of what was happening in my life. But I was also having quite a bit of pain and injury. And then I was doing high intensity exercise at the same time, and actually found that I was putting on weight. And so as I was putting on weight, I was doing more exercise to try and counteract that. And in fact, that was making me put on more weight. So I stopped and just went back to walking and low intensity exercise, so a little bit of resistance training. And that feeling of putting on weight so quickly really dissipated. So that was through the CGM, and that was very eye-opening.
Oh my God. Okay, so what are your ultimate glucose levels or the readings that you would want to be looking at? As you say, if you've had your blood tests and your GP says, look, everything's even, you're looking great, that's because it's over a period of time. What we're trying to avoid is this kind of rapid spiking whenever we eat or whenever we exercise. So you just want a sort of a gradual mound, I suppose, do you? But between a range with no peaks and crazy graph business going on.
So the ultimate range is around about 4 to 6. Okay, so it can drop around 3.8, to 6.2, that kind of stuff. But ideally, that is your metabolic, that's your ideal optimal range, is between 4 and 6. When you eat, you're always going to, that sugar level will naturally rise. Processing the energy, it's coming into your bloodstream. The body is then, taking that energy where it needs to go, right? So it's very normal to have what we call a postprandial. Prandial means, meal rise. But when you get a sharp rise, like Lindsay was saying with her soft drink, that sharp rise causes a stressor of the body, and that will create a chemical cascade that will actually plummet the sugar back down again, because it's quite stressful to have that much glucose there. And so you want to minimize the amount of spikes that you do have. And so what we have done with the data is shown people when you have a spike over 2, or whether you have a spike over 3 or a spike over 4. So that's from baseline. So let's say your blood glucose levels were 5. If you go up to 7, that's not too bad a spike. But if you go from 5 to 9, with an addition of over 3 or 4, that's actually, considered a stressor of the body. And so we look for the number of spikes, the time that it takes to return to baseline as well. So when you've got a lot of insulin resistance, it takes a long time for the sugars to come back to baseline. So we look at that, and we call that time in range. And so so the Vively program and the CGM program is all about wellness and optimization. So there is some aspects of the literature that is a little bit light on, because a lot of our science is all about disease metrics and not so much about optimization. And so the solid research required for what is optimal for each human is actually a little bit lacking, as opposed to what we know about, say, what a disease and how a disease creates more and more disease. And so we've kind of gathered what we think is the optimal level. And obviously what we want to try and do with the program is just get better and better over time. What we know is that when people have got like type 2 diabetes, if they were able to improve their lifestyle, for example, go from very little exercise to a half an hour walk every day, the difference in their body function is really big. They get a really big increase in the effectiveness of the body, or the optimization of the body. So they get a lot of bang for their buck. When you're a super healthy person and you go from walking an hour a day to walking 75 minutes a day, you're not really going to notice very much difference on a CGM, for example. So you're absolutely right. We want to look at what we call time in range. We want to look at the number of spikes, and we want to look at the overall stability. So there's a new metric that we can't get in the general practice rooms called glucose variability. And this is where CGMs really come into their own. Glucose variability is how high and low your sugars are. And that is associated with cardiovascular risk and stroke risk. And so what we know is with type 2 diabetes, even if we can get their glucose levels to be improved, it doesn't necessarily relate to improving their cardiovascular risk, because we know that those two go hand in hand together. And so glucose variability becomes a really important factor to look at. The only problem with glucose variability is we don't exactly know what is optimal. So that's kind of like, and we think, okay, well, the steadier that we are, the better it is. And often what people also experience is that when they have steadier blood glucose levels, their energy improves, their weight management improves, their cravings improve, their sleep improves, and their mood improves. They're all those subtle, nuanced, very personal symptoms that make a big difference to a person's everyday life.
Over at You Must Try It, we've discovered so many fabulous low-tox skin and makeup options. Many of our guests have spoken about reducing our overall toxic load, so that has become a huge priority for me. I've slowly moved to low-tox products, and You Must Try It have made it really easy. We only stock low-tox products we've tried, tested and love at youmusttryit.com. So we have done the research for you. If you haven't visited us already, please stop by at youmusttryit.com for 10% off your first order. I'm gathering that continuous glucose monitors have only ever really been available to people who are already type 2 diabetics, so that their doctors can then keep track of all these things. What Vively offers is an opportunity for all of us to take control of our own glucose journey by wearing one of these. This is quite a remarkable offering to the general public to have that sort of access to their own health. Is this the way of the future, Michelle, that we will have opportunities, whether it be, your Whoop bands or your Vively glucose monitors or even your smartwatches, to kind of calibrate all of this and give our GPs and our medical professionals real minute-by-minute guidance as to what's happening in their patients' bodies?
I do think it's the way of the future, actually. And it's interesting what's happening around the world and kind of coming in at this very burgeoning sort of stage and opportunistic kind of stage. Whereas really we need a wellness revolution, essentially. And I know that the wellness industry is, it's a huge industry and it's $1 billion industry. But often, it can be about the kind of relaxation sort of experience that's going on, which is perfectly beautiful. I mean, who doesn't love a great massage and a beautiful sort of, walk along the beach? But I think when we're talking about wellness and bringing it back into the optimization of health and prevention is a really empowering thing for an individual. Now, what we have to be careful of is information overload and overwhelm. And so there's so many data points that we can look to, but often what happens is people get overwhelmed with data and then become paralyzed by not knowing which way to turn. I think the difference with using a CGM and what we've done at Vively is basically really focused on the interpretation of that data. So it becomes a very usable experience for the person to make very easy, understandable, socially acceptable changes to a person's lifestyle that makes sense. And that is really the foundation, I think, of optimal well-being. We have so much research, so much knowledge and so much data to understand what humans need to do to be well. But there is just so much going against us as individuals and even as groups of people and families, and we're confused by it.
But I think the fact that this is so immediate, and you can have a change of diet or a change of exercise program, but the results take time. And you will look back 3 weeks down the track and go, oh, yes, I do feel a little bit different. The fact that you can watch this happen live as you ingest something in your body, to me, is just amazing.
And the research tells us that this is really, really, really powerful.
I want immediate change. We want immediate change, don't we? We want to make immediate changes to know that is going to have a long-term wellness outcome.
That's right. We want immediate changes that are sustainable. So that's the dualistic aspect of this particular program as well. So we get to kind of be playful with personalized insights, but then we get to kind of go, you know what, that's really sustainable. That is a micro change, basically, or that is something that I can do really easily, and I know it's going to work because I've seen it work before. And so that's really the powerful thing. And the research is actually backing that up. There's been some fabulous research on this is with people with type 2 diabetes using a CGM. Like up to 80 to 90% have long-term sustainable lifestyle changes by using this personalized insight-based data set. And it's like even things like I've had patients even sort of say, so now, they go for an extra walk. Her and her husband go for an extra walk after dinner every single night for 20 to 25 minutes, make sure their glucose levels go down. They've changed it so they talk about, the day, they talk about what they need to do. It's all those kind of practical things like, did you call, did you pay the bill, did you do this, did you do those kind of things. And so they've set that into their lifestyle and they really enjoy it. The dogs get an extra walk, they sleep, better, etc. It's those little sustainable changes that have made big differences to people's lives. And that's where we've got to do the work for this pre-diabetic epidemic that we're in.
And also then, the overriding side of that too is we're taking pressure off our already stressed medical systems and the less people going into the system. And it really is about taking control for yourself, but also for the goodwill of everybody else.
Absolutely. I mean, there's so much that we can do. And I think people forget how expensive it is to be unwell and how it's almost demoralizing to be unwell, and I think we were talking about it before, but this mismatch between our mood and our behavior and our energy and our experience of life, like our aliveness, is actually kind of robbed from us. And it's very subtle and it happens over a long period of time. But then to kind of get it back and go, oh my God, I feel so much better, or I'm laughing more, or I'm not so annoyed by, the person I sit next to at work, or just that level of, I guess, nervous system irritation starts to dissipate. And we just be lighter and happier and laugh a little bit more and look at the funny side of things. It's those little nuances that I always find so fascinating. And I love to teach patients to really tune into them because they're the things that really make a big difference to our day-to-day life. And they make a big difference to our ability to sustain our well-being.
It's incredible because I do think a lot of us live on this heightened level that we don't even know we're at the moment. This level of stress when you are one incident away from having your Michael Douglas falling down moment. And I don't, that it's serious. I find when I go to the cities, because I live in a regional area now, I know that my whole physiology changes, my body changes, everything tensens up. I'm alert, and I can't imagine if you're living like that every day, you don't even notice it anymore. But when you do make those noticeable changes in your lifestyle, in your diet, in your exercise, which I suppose if we have a bit of a disclaimer with these CGMs, is there a risk that people can read into it too much, that you can start, throwing yourself way off course?
Yeah, we were very, very highly considered about that at the beginning when we launched the program, and particularly because we have such a lot of issues with body image issues and disordered eating and eating disorders. So we were really concerned about that, and we really made a huge we had a huge intention to make sure that the language and the tone of Vively was very much an inquisitive, curious tone and not a rigid instructional, this is how you should be and this is what you should do. So very invitational. But what we've actually found is that, and this is not published data, but what we've found is that people that use it can actually identify that they do have a dysfunctional relationship to food, particularly around that menopausal stage of life, and also for women that are a bit older. So there's quite a growing group of women in their 60s and 70s that actually have always had a dysfunctional relationship with food. And so the CGM can also show us those things and highlight it for people as well. The other thing that we found too is that for people that have particularly overused one pillar of health, so for example, they might have been quite fanatical about exercise and not really looked at the other pillars like stress and sleep and diet, and found that when they use the CGM, if they were able to then control and stabilize their blood glucose levels, their anxiety levels and their irritation and their relationship to food actually changed, and they actually realised that it was a lot about their physiology and not actually their personality that was craving or binging or those kind of things. A lot more research needs to be looked at in this space, but it's a really good point, is that that's why we've designed the program to be about a playful experience to learn about your glucose levels and those 4 pillars. But also we have an in-house dietitian, and she can really help people that are a little bit overloaded or overwhelmed by the data, or perhaps maybe might have some of those confusing relationships with food. And the other thing, we have a practitioner dashboard. So any practitioner can sign up to this dashboard for free. And that gives the patient the ability to share that data with their practitioner. And so we recommend that people go back to their practitioner and they have that really good conversation so they can deep dive. And if there is any parts of the data that they've misconstrued or that they haven't understood properly, that a health professional can help them to navigate that as well.
That is wonderful, because we all love the data, but not many of us know how to process it properly. And again, it is building that relationship with your GP as well, and then saying, I'm taking control of this, but I will need you to assist me, or here's the information, how do I digest this, and what could we be doing as a plan to get on top of things. Michelle, I think it's extraordinary. I love the fact that we are being able to access this amazing research and study and science now in our everydays. I promise I will use my Vively very sensibly, but I will be posting all of my little spikes and results, because I experiment with all sorts of wellness ideas, and just down to, as you say, changing your milk might make a huge difference. The way you exercise might make a huge difference. So for everybody across the board, no matter size, height, weight, glucose levels should be around the same.
Yeah, no, that's a really great question. I mean, when we do high intensity exercise, our glucose levels go up. Okay, so it's really normal. And, we talk about that and educate people in the dashboard or in the app around about those kind of things. Athletes often tend to run low because, they're highly musculature and that kind of thing. And what we find is that because in athletic bodies, they tend to use up a lot of their antioxidants. When they run low, that can often represent their need for extra antioxidants as well. So that's we can kind of use it in that particular domain as well. Some people are more prone towards insulin sensitivity as well. And so for people that have got prediabetes or do have type 2 diabetes, they need to expect that it's going to take some time to drop down to that normal range, and that's really important. The program's not designed for those with type 1 diabetes. It hasn't been written with those people in mind, and so that's a real caveat that it's not designed for that as well. It's designed as a wellness program that teaches people about that intersection of health and well-being. But essentially, it's a little bit like our blood pressure. Everybody's blood pressure should be between 90 and 140, over sort of 60 to 90. Now, obviously, there's a little bit of wriggle room depending upon that. But when it's high, it's high. We just have a metric, and when it's pushed above that level, then that's out of the homeostatic range for the physiology of the human being.
Michelle, I can imagine being diagnosed initially with type 2 diabetes gives a lot of people a bit of a fright, a bit of a scare. Oh, I didn't think I was heading down that path. But then perhaps they go, well, I'm not prepared to give up on this, or I'm not prepared to give up that. What is life like for someone who has long-term type 2 diabetes? And can you get rid of it altogether, or are you with it for life?
Yeah, they're all great questions. I mean, you can reverse it. So even people that have got a diagnosis of type 2 diabetes can reverse it given the correct treatment, and particularly reversing the weight gain, the central obesity, increasing muscle mass, all of those kind of things that we just discussed. It is, all hard work. But a lot of, like as you said, like when you first get diagnosed, there's a lot of fear in response to that, because type 2 diabetes is really a slippery slope into some pretty unfortunate kind of complications, including blindness, kidney failure, heart attack, stroke, amputation, poor skin healing, nerve pain, and even dementia and mood issues. So it's something that you really do want to avoid. One of the things about people with long-term type 2 diabetes is it is a long-term disease. So it's not like when you get diagnosed, they're like, okay, well, in 6 months, you're going to have this, this, and this. It's like a 10 to 15, 20-year kind of process that's very sanguine and long-lasting. And so people get fatigued from being unwell. They get sick of having to maintain a sort of a diet and lifestyle, particularly when they don't really understand it. And so when people take their finger prick blood, tests and write it in a book and go to the doctor and have their medication sort of tweaked alongside those lines, there's an apathy and a lack of motivation that occurs when you've been unwell for a long period of time. And when you've got type 2 diabetes, you're often fatigued. So your ability to use energy is very poor. And so that's not only like physical fatigue, but it's also mental fatigue as well. So there's a lot of issues. You don't want to go there, essentially. Like, we want to kind of catch you if you're pre-diabetic and really start now while, people are younger, they're enthusiastic, they can reverse it much quicker. That's really important.
Which leads us to Vively, which is this amazing little continuous glucose monitor that's now available to us all to be able to take control, whether we are in that pre-diabetic stage where we don't even think we're remotely close, but ultimately have no idea. Tell us a little bit about this as the Chief Medical Officer for Vively.
So Vively is a lovely little app. So we allow very easy access to continuous glucose monitors for the general population, which means that there's a consideration to be able to pick up whether your insulin is irregular or your glucose levels are irregular in real time before you go and get a more serious diagnosis. And that can allow you to really understand how your lifestyle impacts your body and how your body impacts your lifestyle in some ways too. And so the app is designed, as I mentioned before, we've got an in-house dietitian that you can use. She's absolutely brilliant at reading the data and assisting people through that data interpretation. And also we've got some fun little prompts. It's almost like a gamification, to try and experiment in that early stage so you can get to understand the changes and how it changes with things like exercise or, with some poor food choices, naked carbs, as we kind of call it. What happens when you add protein? What happens when you, put a couple of nuts and seeds on your salad? Those kind of things make it fun, make it accessible, and, has the potential to really change your relationship to your own health and well-being.
Michelle, really exciting. Thank you. I know a lot of our community are going to want to investigate this. And as the Chief Medical Officer for Vively, which are your continuous glucose monitors, it's such a wonderful, easy to digest system that we can all grab hold of. I'm sure there'll be a lot of aging projectors jumping on board. We really appreciate your time today. Thank you.
It's my pleasure. Thanks for having me, guys.
I really do think this is a super important episode. Getting our glucose levels stable is something for all of us to consider. And I am going to be tapping into using one of those Vively glucose monitors for just 2 weeks. I think it's a great place to start if you have any concerns or if you want to be proactive about your health journey. I will keep you posted on my results. If you are interested to learn more, please visit the show notes and you will have access to our VIP 50% discount. It's a link there for Aging Project listeners. You don't want to miss out on that one. I cannot stress the importance of today's episode, so please share it with loved ones and let's get on top of this pre-diabetes pandemic before it becomes a serious health issue that is going to impact our aging well journey. I am Shelley Craft. It's been a joy talking to you. This is the Aging Project podcast. A final thing before I go. If you enjoyed today's episode, can I ask two small things of you? Can I ask you to share it with someone you love? We would be so grateful for your support and help to spread the aging well message far and wide. We want everyone aging well alongside us. And if you wouldn't mind subscribing to the podcast, it helps more than you know and means you'll never miss an episode. Thank you so much. Until next time, I'm Shelley Craft, and this, my friends, has been another episode of The Aging Project. As always, the Aging Project podcast is for educational and entertainment purposes. Always seek medical advice from a qualified practitioner.